Hello everyone, welcome back to Inquisitive Creation. My name is Gilo, and I will be your trusted companion to explain things you ever wondered about but does not exactly know what they are. Today, we're diving into a topic that's been generating a lot of buzz lately. A topic regarding the potential long-term health effects of COVID-19. While much attention has understandably been focused on the immediate impacts of the virus, emerging research suggests that there may be lingering health concerns for those who have been infected. So, in this video, we'll explore the growing evidence indicating an increased susceptibility to other serious illnesses following about with COVID-19. Let's get started. First, let's discuss a phenomenon known as long COVID. For some individuals, the effects of COVID-19 can persist long after the initial infection has cleared. Symptoms such as fatigue, shortness of breath, and cognitive difficulties can linger for weeks or even months, impacting daily life and overall well-being. But what's particularly concerning is the emerging evidence, suggesting that long COVID may also predispose individuals to other serious health conditions. Recent studies have highlighted a concerning trend. Individuals who have recovered from COVID-19 may face a heightened risk of developing various chronic illnesses. Conditions such as heart disease, diabetes, and neurological disorders appear to occur at higher rates among those with a history of COVID-19. While the exact mechanisms behind this increased susceptibility are still being investigated, it's clear that the impact of the virus extends far beyond the acute phase of infection. For instance, Bloomberg recently featured a post-COVID spike in heart disease deaths, which is currently puzzling scientists.
What do we know? We know, of course, that millions were killed by COVID, but now this new research that you've been reporting on suggesting that heart disease deaths also jumped during the pandemic. What do we know? What are the details?
Right. Well, you have to remember that heart disease has been the leading cause of death for decades at this point. But we were doing really well before COVID came along. Those numbers were declining, and in fact, cancer rates were rising. Then COVID hit, and the numbers were, astronomical. How many people died? And so you would have thought that you'd switched out one for the other, right? That COVID deaths were replacing some of these heart disease deaths, especially because the people who were dying from COVID were older and in many cases sick. But that's not what actually was found. In fact, in the U.S., for example, just over the first 3 years of the pandemic, there were 250,000 additional deaths in adults aged 35 and older. So we saw not only the COVID deaths that didn't exist prior to 2020, we also saw a surge in these heart disease deaths. So we weren't trading off one for the other, and that's something that we're continuing to see going forward.
The problem is that it's easy to be complacent about COVID-19. Most people experience only mild issues, fever and coughing, maybe congestion and shortness of breath. But the coronavirus is capable of causing much more than a simple respiratory illness, affecting organs throughout the body. Experts say that they have seen people having symptoms from almost head to toe, in terms of how they feel, how they function, and what they can do. The new year of 2024 started with an increase in COVID-19 hospitalizations in the United States, prompting experts to advise caution, especially for those at high risk. While the short-term effects of COVID-19 can be flu-like, even mild cases can lead to long COVID, a constellation of problems that can persist for weeks or months. More than 200 symptoms have already been linked to long COVID. Because COVID-19 typically affects breathing and can lead to problems such as pneumonia, many people may think it's primarily a lung disease. It's not that simple, according to experts. It can be argued that COVID-19 is not a disease of the lungs at all. It seems most likely that it is what we call a vascular and neurologic infection, affecting both nerve endings and our cardiovascular system. It's no surprise that experts say SARS-CoV-2, the name of the virus that causes COVID-19, is complex, with many of its pathways just beginning to be understood. But some things are becoming clear. one of the best reviews of long COVID symptoms, which appeared last January in Nature Reviews Microbiology. It detailed the disease's effects throughout the body, including the pancreas, blood vessels, and reproductive system. SARS-CoV-2 is excellent at triggering your immune system to go from 0 to 100. That revving of the immune response leads to both a wide swath of inflammation and excessive blood clotting. Perhaps the viral replication is going on in the lungs and esophagus, the area at the top of the throat that connects the nose to the respiratory system. But the inflammation that the virus triggers is systemic. Indeed, one theory for why COVID-19 survivors may be more prone to other illnesses revolves around immune system dysregulation. The virus can trigger a complex immune response in the body, sometimes leading to persistent inflammation and immune dysfunction. This dysregulation not only impairs the body's ability to fight off new infections, but can also contribute to the development of autoimmune disorders and other chronic conditions. In essence, COVID-19 may leave a lasting imprint on the immune system, altering its function in ways that increase vulnerability to future health challenges. Here are some parts of the body significantly affected by COVID-19. First, the brain and the nervous system. The virus and the immune response can have several different effects on the brain. The exact causes of brain-related issues are not clear, but it does not appear that the virus is directly attacking brain tissue. Rather, it seems that the ramped-up immune response leads to clots that could cause brain problems. A lot of patients have described it as feeling like they have a concussion, and it can persist for several months after COVID, even if the initial case was mild. In addition to the cognitive impairment, experts are also seeing worsening or new-onset migraines, new neuropathy in the legs and the arms, numbness, tingling, and difficulty in walking. COVID-19 might also be unmasking other neurodegenerative conditions such as Parkinson's disease. Doctors have reportedly diagnosed new cases of Alzheimer's disease in people who, before COVID-19, were functioning fine, then developed symptoms, and doctors do not exactly know why. Second, the heart and blood vessels. Research shows COVID-19 infection can increase the risk for heart-related problems such as myocarditis, a rare inflammation of the heart, and an irregular heartbeat known as atrial fibrillation. The risk of dangerous clotting, including deep vein thrombosis or clots in large veins and pulmonary embolisms or clots in the lungs, is small but stays elevated for up to a year after the infection. Many factors might be playing into COVID-related heart problems, according to experts. This include microclots or tiny blood clots and autoimmune response targeting heart muscle cells. A recent study in Nature Cardiovascular Research shows the virus may infect coronary arteries, causing plaque buildup to become inflamed and break off, which can lead to a heart attack. Third, the gastrointestinal system. Interestingly, the gastrointestinal system's mechanism may be a little different than what impacts the heart. One theory suggests that the virus finds a hiding place while the rest of the body fights it off. Experts indicated that they have found in multiple studies that COVID can remain in our gastrointestinal tract for weeks and months after it has resolved in the rest of the body. The exact place where the virus might hide is still up for debate. People can have nausea, vomiting, and diarrhea. A large study of veterans published last year in Nature Communications found people with COVID-19 had a higher risk of gastroesophageal reflux disease, irritable bowel syndrome, and other gastrointestinal problems more than 30 days after infection compared to people without COVID-19. The risk was elevated even among people who had mild cases of the disease. Fourth, the kidneys. Kidney problems were common in a 2023 study published in The Lancet Respiratory Medicine that looked at organ damage after COVID-19 infection. Researchers don't necessarily know whether kidney problems stem from people getting sick, people with high fevers and taking in less fluid. or because with a virus that can go anywhere and cause inflammation anywhere, you can have all sorts of problems. Now, what do we need to do? Not everyone who gets COVID-19 will have these problems, but people experiencing symptoms can reach out to their primary care physician or a long COVID clinic. What everyone can do, according to doctors, is take steps to protect themselves and those around them. The first step is to be cautious if COVID-19 is surging in your area. Consider wearing a mask in crowded public places. A lot of people have COVID now, and it may take a while for them to test positive. The second thing is get vaccinated. It really does seem to be highly protective. The Centers for Disease Control and Prevention recommends everyone ages 5 and older get the updated COVID-19 vaccine to avoid getting seriously ill from the virus. The third thing is controlling your cardiovascular risk factors. That means getting high blood pressure, diabetes, or other chronic medical conditions under control. It will all decrease your risk according to doctors. In addition, if you have COVID-19 symptoms, stay away from other people to avoid putting them at risk. It cannot be overemphasized the importance of vaccinations in general. For people with heart or lung disease, cancer, or suppressed immune systems, as we continue to grapple with the ongoing COVID-19 pandemic, it's crucial to consider the broader public health implications of the virus's long-term effects. Not only must we provide support and resources for those experiencing long COVID and its associated health concerns, but we must also redouble our efforts to prevent the spread of the virus in the first place. Vaccination remains our most potent tool in this fight, not only for preventing acute illness, but also for mitigating the potential long-term health consequences of COVID-19. In conclusion, while much remains to be learned about the long-term health effects of COVID-19, the evidence thus far points to a troubling reality. Individuals who have been infected may face an increased susceptibility to other serious illnesses, from heart disease to mental health disorders. The repercussions of COVID-19 extend far beyond the initial infection, underscoring the importance of ongoing research, support, and prevention efforts. So, let's continue to prioritize public health measures, support those affected by long COVID, and work together to build a healthier, more resilient future. Until next time, stay safe and take care. This is your friend Gilo, signing off from Inquisitive Creation. Thank you so much for watching.